Hey, it's always a little lagged when I start. Okay, so it says I'm live. Hey guys, and welcome. Thank you for being here so much. I see people were already waiting for this topic. So, we're talking about cloth masks in COVID-19. Why is no one talking about this craziness? Can we just sit with this for a second? I am shocked. And I've got a few things to say about it. I actually have a lot to say about it. So if you have to run because of your kids, there's going to be a blog post about this in a couple of days with all of the links I'm talking about. If you are okay with and think we're in a really good place with the coronavirus right now and how we're fighting it in the US or anywhere, this rant is not for you. If you're seriously curious or inside somewhere, you're thinking, WTF, then keep watching. I'm glad you're here. Tell us where you're watching from in the comments and your word for the day, how you're feeling. Tell us in one word. Hello, my name is Mandy. Welcome to my therapy session. Seriously, this is therapy for me. This is a nurse rant. This is not an idea that came from you guys. Those are coming, that's what I've been doing. Hey, Carrie. But this is not that. This is from my heart. It's sitting heavy with me, and it's been sitting heavy with a lot of my friends who are in the medical industry. So that's what you're getting today. It is my therapy session. It is not medical advice. I'm going to be reading some articles or parts of some articles, and it is my rant and my feelings toward what is going on, what I've heard personally. So I am not representing a medical center or anyone in particular. Okay. So this is not medical advice. Don't do anything I say, except right where you are from in the comments. Give us a like if the videos have been helping, thumbs down if they're not helping. If you're super triggered today and don't want to hear any more bad news or truth, don't watch this. Just save it, share it for later. Share it, but don't watch it. All right. Your word for the day. So today, the mantra, the affirmation, I'm going to take from yesterday's class that Julie and I taught live. It was 3 hours of amazing fun and information. It was jam-packed and loaded, and people are already asking for the replay. That's how much we packed in. It was so good. That's not what I'm talking about today. But to take the affirmation from that, our affirmation today is feel your feet on the ground. Feel your feet on the ground today. So put them there, feel them there. Okay. Get grounded. It's okay to feel the feels today here with me in this video. I'm going to share my feels. I'm going to share questions and comments at the end. So I'm going to power through. I've gotten comments that I talk too much. Again, not the video for you, girl, dude. But sometimes taking the answers from the place of your employment, wherever that is, when they say it's the best we can do, sometimes that may not be enough for you. And if you're feeling that, I'm feeling that with you. All right, cloth masks. Did you see my picture? Did you see the thumbnail? This is not a cloth mask. This is a medical mask. This is N95. I hit the jackpot. No, this is old. I didn't even take this from anywhere or was given this. This is not dirty. It's never been used. It's a test. That's why I know nurses are like, that's not real. It is real, but this was added to it because everyone gets annual fittings when they're in the inside of a medical like business location, building, taking care of patients. So this is a hole where the test tube goes to see if it's working for you, and it's a fit test. So this mask fits me, but I can't use it because it has a hole in the middle of it. So this is just a demonstration now. I just kept it. I was actually going to use it, or I might have used it while painting, and I plugged this up with some tape. I think I was painting when I was pregnant one year. So that's what this is. This is a real mask, but it's not effective. So don't come knocking on my door trying to get my mask stash because I don't have one. I got this from my employee health. They said, do you want this? And I was like, yeah, I paint. I'll take it, even though it's not effective for the flu or for airborne viruses. So that's what this is. We're talking about COVID-19, the coronavirus 19, SARS, COVID, all of the names. It is an airborne virus that is passed by droplets. droplets. So for droplet precaution, this is fit tested. That's how important. That's how big of a deal these masks are. Probably that's why they're so expensive also. Um, Potentially could be why hospitals don't have enough is the expense. I mean, someone asked me a question about why a business is changing something or why there's a decision that's made. You can usually trace it back to money if it's a business. So yeah, that's a big deal. This is like a big serious mask right here. And this is what's recommended. We used this in 2019 for H1N1. We used this for SARS. We used this for flu and TB and things like that. This is also paired with a mask because you have eyes that can get infected too. Okay, so where did cloth masks come from? Like cloth masks, a bandana is not this. Can you agree? Right? So at first, when I first heard about that, I thought it was a joke. And I haven't been like scrolling social media because I've been busy, right? Haven't you? Worrying, reading with my kids, working, teaching, connecting with pregnant parents and helping them get through and teaching them what they need to know and want to know. Busy. So I heard that and I was like, that's a joke. No, I found it. It's from the CDC on March 17th. The very bottom, the last bullet on March 17th is, if you're in a crisis, use a bandana. I thought that was a joke, but it was on the CDC website and it's dated March 17th, which was whenever that was, a week ago. So what also is a joke to me is that hospitals are asking people to sew masks for them. Hospitals, like the medical facilities that don't have enough supplies due to lack of ordering, lack of storage. If there's another reason, I would love to know. But it seems like because they didn't order enough 5 years ago, every year when they expire, whatever they need to do to keep updated, up to date, and ready for an exposure like this, or nuclear war, like what's that called? Bio warfare, right? Which we've experienced in this country. And now, because there's no preparedness, they're asking people at a vulnerable time. They call it willing hearts, is what, let's see, is that the LA Times quoted? Willing hearts to sew cloth masks. They're taking the hero role by recruiting all of these cloth masks so they can do their best for their employees. Got any feels about that? Got any feels about that? Like, we didn't order enough. Sorry, we're not ready. Let's get all of the people in the community to sew some free masks. Okay, we're going to talk about what those masks can do, but I think it's false hope. And I think they're taking a hero role, which I've seen other times in positions of power like that. And I teach about childbirth and labor in hospitals, which is a very unique thing to have in a hospital because you're asking non-sick people to go in and multiply inside a place where sick people swarm. It's really weird, right? So if we create problems or we make so many tests to create confusion, and then there's all this confusion going on inside L&D, inside labor and delivery, inside childbirth area, and then there's this loss of control because birth is inherently a little bit out of control or unpredictable. Someone takes a hero role and saves the day, when if you trace your steps back, maybe a lot of steps were added that were unnecessary. I'm not saying that for a specific situation or a specific location. That's what I can see as birth and medical model. That's just one idea. One idea. So I think that this is an opportunity, a silver lining, not to spend money in our country, which I heard yesterday or the other day. This is an opportunity to dig into priorities, our own priorities for our family and our health, what sounds right to us, what sits right in our heart when we let our feet hit the ground and feel that feel. And it's an opportunity to see the priorities around us in the companies and the industry that's supporting us. If you can relate, show me by a thumbs up. Because here's what's going on. In January, we knew about the virus in China. Now, I'm hearing that masks take 18 months to kind of like produce and send out and for you to get. So I'm not saying if they ordered masks in January, then we'd have them because it's only been 2 months at the time of this recording. And this recording is not like, I don't know how long it's going to be my thoughts either. So this is not, there's no take backs on this. I know it's out there, but I might change my mind. And information is coming out daily and hourly. So we knew about the virus in China. I'm not sure if people ordered masks. I'm not sure if hospitals or medicine ordered masks or your offices ordered masks. But I am sure that nothing changed. Nothing changed in January or February, right? I mean, birth was still happening in hospitals and people were still putting masks out and not teaching about them. There didn't seem to be a lot of, I mean, your butthole's clean, but was there a mask situation in January when we thought what this might be? Were we listening to the scientists who were telling us that this has happened before? That's the question that you can answer for yourself. What have you heard? What have you learned? How do you feel about that? Because it has happened before. I mean, haven't we gotten clues about how to protect ourselves from the viruses that have come before this? I've experienced those viruses. H1N1 flu, a mild pandemic, was in 2009. It didn't kill more people necessarily than the regular flu or seasonal flu, but it did kill and make sick and injure a different population. So it affected us very differently. And we saw what that might be like. And it greatly affected pregnant people in horrible ways. It was very scary. We wore these masks. Hospitals wore these masks all the time if people had symptoms. We know, if you remember, nurses, let me know. Were you nursing? Were you practicing in 2009? Do you remember the shortage of masks? Do you remember how you had to be sure when you used it? And if you ran out, you had to go find boxes of them because they weren't readily available. They're disposable. You use them one time, you throw them away. You don't take them into other people's rooms. You don't take them off and put them in your pocket in a bag. It's the intention, right? Okay, so if we didn't learn anything from H1N1 because it was mild, the Spanish flu, 1918, that was severe, killed 50 to 100 million people. We know these viruses happen. Who's using that information and that history to help us in the future to do better and be better, to protect the people that need to be protected, the people that are taking care of the community. When they article in the LA Times that popped up a few other links to articles, which I found very helpful. They quoted that, it's on the back. According to federal officials, the strategic national stockpile contains 1% of the masks and PPE, which is personal protective equipment, that we'll need. Shields, gloves, mask, gowns. 1%, except Spanish flu and H1N1 both told us what could happen. And now we're a global society, so we could be across the world in faster than we've ever been before. So, all right. It's not like we didn't know what was coming. So for the timeline we did know it was coming because I know personally of someone that was being asked on March 14th, before we were asked to use bandanas on our faces when we ran out of masks, on March 14th, they were already asking nurses if someone looked sick, acted sick, we thought we were going to test them for COVID, except there was no test. Go ahead and put your bag in a paper sack and use it again anytime you need to. What? They knew they didn't have enough, and they knew how long it took to make more. I'm not saying this to spread fear. I'm just really pissed about it, and I'm really heartbroken about it. And I'm putting these links together, and it's just making me more upset about it. So I'm hoping to start a conversation, and maybe, of course, I don't know all the things. I know there's a lot of players and parts and pieces to this, but it just seems like we knew this could potentially happen, and now it's happening. And it seems like nurses are disposable, and I don't agree with that. and it's upsetting. So on the 14th, we were already treating COVID people or possibly COVID people, and we were already asked to not use masks the way that they were intended. So we knew there wasn't enough. Of course, we knew if we only had 1% in a stockpile, how would anybody think we would have enough masks or PPE to keep everyone safe and keep the spread not happening inside hospitals? On March 20th, I got an email from the Virginia Board of Nursing that they were waiving regulatory barriers to expedite nursing licensure. That's scary. That scared me. That surprised me how fast that came. That was before I got any email from other governing bodies about recommendations for nurses and how to protect ourselves. But I did get an email that the governor was expediting nursing licensure. What does that mean? What do they know is going to happen to nurses when they say, you can shorten your time, take your test, and then take your pass paper and go get a job? Start working. I mean, it's great for people who want to start working, but what are they walking into? So I think they knew, I don't know if they knew the evidence. The evidence, I don't even know how strong it is. I briefly reviewed these two studies, but I found them interesting. That McIntyre et al. In 2015 did study medical masks versus cloth masks. I think it was in India. I think it was somewhere not in the US. And they were testing against a flu-like illness. The rate of that flu-like illness was significantly higher in cloth masks than in medical masks. It's not, we're doing our best, and it's not, we don't know what potential benefit a cloth mask has. They do know, because I see two studies that say that they're not effective. The studies, there's moisture retention and poor filtration, which you can imagine. I mean, there's a huge difference between a homemade mask and this versus 44% exposure versus 97% exposure. 97% exposure with a cloth mask. So 3% improvement than going without a mask is what that says to me, but I also am not a pro at reading studies. I read the Cliff Notes. The study states cloth masks should not be recommended for healthcare workers, particularly in high-risk situations. So when our leaders say this is the best we can do, just try anything to keep yourself safe, you know, the people doing these studies are like, yeah, but don't use a cloth mask if you can help it. Of course, having a real mask, not even in N95, is going to be probably better, is what it seems like. I don't think they were using N95s for this study all the time. And I know it's better, and I'm not saying don't do anything, because I think we're at a point where a lot of options are not options anymore. We just don't have the equipment. So reusing it is an option, and using cloth is an option, but it's false hope. Okay, it's false hope, and it's weird. The study in 2013 in the Journal of Disaster Medicine and Public Health Preparedness had the same conclusion. They only used it in a last resort to prevent droplet transmission from infected individuals. And what's really curious is what I read by that author, Davies, by that author of the 2013 study, says that they should not be considered sufficient protection. So what that researcher is saying, there's always like recommendations at the bottom of the study, and I'm talking studies because medicine talks studies. Medicine loves studies. Medicine loves evidence. If we could talk about inductions, we'd have to talk about the ARRIVE trial, one trial, and how the culture of birth inside of a hospital changed the next day. And I see it from nurse and time and again, no matter where they are located. The ARRIVE trial changed everything. So these studies are studies. They are evidence that cloth is not enough. And the recommendations are it should not be used or considered sufficient protection. So that person who's using a cloth mask has been contaminated. For individuals, it then says, for individuals not in the medical field, the number one value of cloth is the potential to help prevent you from spreading to others. What is the difference between individuals in the medical field and not in the medical field? I understand that's when and this is where I want feedback. Like, I want to have this discussion because I'm not getting it. Why would they say medical professionals can use it when we're thinking we don't want medical professionals to get infected, right? There's few of them, many of us, they're in the war zone. We're coming in and needing help, life-saving procedures. We need the army to stay strong so they can keep us well and we can die and we can kill. Like my son says, when is the coronavirus going to die? So I understand why we want to protect medical health professionals. But then the same mask, cloth, handmade from Joanne Fabric, used in the community is for individuals not in the medical field, totally different, right? Because I'm in the medical field and I also shop at Kroger. Like, what? So when I'm not in the medical setting, I use it to prevent other people from spreading the disease. But what they've shown is that with the increase in moisture and the fact that it's not really a barrier, you're actually putting, it sounds like, virus up against your face while you wear it all day. That is not enough for all of the people in the hospital. That is not enough for medical providers. That is not enough for me to think that now my medical provider is not contaminated, because it sounds like they're contaminated. If cloth isn't enough, it could still be considered contaminated. Isn't it just buying time for health professionals to keep working until they suffer symptoms? Which is horrible to say. And I've racked my brain for 2 weeks to have this conversation with you, because who knows what's going to happen. I am not going up against big medicine. I am just putting out some questions that I have rolling around in my head, and I want to talk about this with you. What do you think when you hear this? What is it really like on the front lines for you? How does it feel when you're told these things and you don't, like, does it feel right inside? How does that feel? It seems like it's buying time until the nurse or the provider shows symptoms, when they have to be on isolation for what, 2 weeks? And they can't work. How many people are they accidentally infecting during the time, in the meantime? I mean, no healthcare worker goes to the hospital or any job and says, I hope to infect someone with my flu today. No, that's not why they're there. They don't want to be doing that. What a weird place to be, feeling like I am not getting adequate protection. I could be shedding the virus, because medical professionals, we get it. We understand. We don't have to learn about this. We have this inherently in our foundation of understanding. We know we could be shedding sickness without showing symptoms of sickness. I don't even know how they go back to work, but I'm so grateful they do. But am I? I am torn about this. It seems like nurses are even more disposable than the masks. It does. It really does. And it's sick. It's making me sick, and maybe I'm not understanding it. And I really, really hope that's the case. Please tell me how you're feeling about this, because I really hope that's the case. Another true story, if that wasn't enough true stories, a midwife friend was denied a mask, a medical mask, which has a pretty good barrier rate, the best we have. She was denied a mask because she wasn't an MD. She went to a shift where doctors were taking care of patients with N95 masks, and the nurses and the nurse midwives weren't given masks. The hell? I'm not saying doctors don't need masks. I'm saying, what kind of hierarchy is that? Is it really that big and that defined? Who makes that decision? Can you really manage a pandemic without the other staff? Can you manage a hospital without the most number of employed people, which are nurses? Highest, what is that called? Like, most number of employees in a hospital are nurses, is what I'm trying to say. I mean, who made the rules that it wasn't all pregnant staff get one of these, no matter what the letters are behind their name? I'm not saying that the doctors aren't important players in the team. I'm saying it's a team. Without one, are there others? Can you do it? I don't know. That's what I don't know. What about only the staff with children? get N95s? What about only the staff over 50? Seems legit. That's the highest risk, and pregnancy is unknown risk, but they've had potentially bad outcomes, definitely bad outcomes, potentially bad outcomes with this one. We just don't have enough evidence and numbers and time to know. Why not put them on pregnant people and older people? Staff with asthma? I mean, we're really getting into it when you start doing stuff like that. You start hearing stuff like that. That gets really confusing. How does that feel going to work? How does that feel on the inside? I think it's okay for the best we can do. I think it's okay to feel like it's not enough for you. And I know that's not an answer that's easy because I've battled that question before. Other times, other situations, I have had that question in my head. What if it's not enough? Because this is where I work. This is how I feed my kids, all the things. Another truth, labor nurses float to other parts of the hospital and then back to labor. So these are the pieces of the puzzle that I'm putting together when I'm reading and when I'm seeing all of this information come back. And my heart is with nurses and medical providers because that's who I am. I'm a nurse. I'm not a medical provider. My heart is with also pregnant people and parents. That's who I serve. Children, older folks. That's who's in my family. So nurses from labor are floating to other parts of the hospital. I'm not saying this to make any sort of statement, except I want you to know what is happening so that you can make educated decisions and choices for yourself and for your own family. That's a thing that's happening. It's been happening forever. As long as labor has been in hospitals, it's happening because nurses can move back and forth. Not all of them love it. We really love the place that we're in and the type of people that we serve on that unit. But hospitals are for sick people. Laboring people and prenatal people aren't necessarily sick people. But when your nurses start having inadequate protection against this pandemic and they're moving around, not in the same day necessarily, but if they're not adequately covered with a cloth mask or not enough masks or a contaminated mask or contaminated equipment, and they're shedding, they're back on labor and delivery, we don't have enough evidence to know that that's a safe place. That's a safe thing to do. We just don't have the evidence. And I know hospitals are doing all that they can, but I just think when we think about what are the priorities, are we really doing no harm? And why are there a shortage of nurses in hospitals that are functioning at not even capacity? Like, we just don't have extra people to help with this. We don't have extra people to go in and be the healthcare providers that we need to take care of all the sick people that are coming in. All right. I think that in these times, priorities are highlighted, and I don't think it's the time to be complacent. I'm not saying quit your job. I'm not saying be unhappy with your job. I'm just wanting to talk about how you're feeling in it because I can't speak for you. This is just what's floating in my head, and it feels good to get it out. Doesn't really feel good, but it feels different to have it on the outside. I think it's always time when you're feeling uncomfortable about where you're at to review your options. And I want to come back with options. If you guys want to hear options, I want to share options. I don't have them all. I need to do more research about it. And I'm kind of connecting with a few other professionals to figure out more options, more research. If you want to hear that, let me know. Give me a like. If you want to be notified, subscribe. I believe our bodies are powerful, and with the right support, we are unstoppable. That's nurses and parents. It's all of us. So I hope to share right information, maybe new information, maybe highlight some of the weird discrepancies that I'm hearing and seeing. I don't think there's an easy answer out. And if I did, I would be a kabillionaire at the top of your YouTube channel, spouting off all of the right answers for all of the problems in this world to help nurses know exactly what to do. There is no right answer. It's all shit right now. It is. But it's okay if you're feeling inside like this isn't enough for me. This is not an okay option. This doesn't feel right from all that I know about how this spreads and all of the people I'm potentially taking care of, which you do heal and you care, but are you also shedding? Man, I know this is heavy. All the rants are heavy. It's not like feel good. Feel your feet on the ground, as my friend Julie says. Man, that was a good class last night. I can't wait to do it again. Even though it's not easy, because all the questions we're getting from parents are, how do I do this alone? It's heartbreaking. Also, that could be a rant for another day. Let me know how you feel about that. How laboring people are being denied evidence-based medicine now. How do you feel about that? Nurses feel one way, maybe. Parents feel another way, maybe. I can understand if you feel torn. I can. And if you feel both ways, that's okay. I want to know. So message me, write it in the comments, respond. Let's talk about it, right? Because we don't have all the answers. Grace is here. Crystal is here. Shivani is here from India. Kaylee, hey, home is DC. Hey, Mandy, so excited to be able to speak to you live. Hey, Shivani. She says, please comment on birth vaginally for android pelvis. Oh, not today, but I can. What can one do to ensure anterior positioning and engagement for this type? You know, it's off topic. Yeah, it is off topic, but I can talk to that another time, or I can also link down some resources about making space for the baby and encouraging anterior positioning. Sometimes in different pelvic shapes, people have posterior babies, and that's the easiest route. And that's the shape and the way that the baby is born. So it's different for every human, every person, and then every shaped pelvis and every baby. So try not to get stuck on one correct way, because some people just have OP babies because that's their shape of their pelvis. That's how their baby can find a way out in there. Their route out. Anna, my home is Switzerland. I'm a midwife and big fan of you. Thanks, Anna. Amanda, yes, follow the money. Kaylee Harrod, it's a disgrace. Grace, hey, Grace. Hey, Grace. Fancy seeing you here. I do love that people are so willing to do this for our healthcare workers, and in a way, it's uniting everyone. Yep. But it's not going to help. Even with a coffee filter in between layers, it's not the same. No, it's not, because don't you think that healthcare, health industry, medical industry would save money by doing that already? I mean, these have got to be expensive. I can't imagine the numbers. I also can't imagine like the money that goes into healthcare right now, and the quiet, almost hiddenness of our insurance companies right now, who are, the puppeteers of healthcare. Like, where are they? If they could have saved money by using coffee filters and Joanne fabrics, they probably would have. But they probably try to go for effectiveness to save lives. I really think they do. But yeah, if it were an actual option, I think it would have happened faster and it would be effective. But they say, like in Italy, I mean, it was like a cesspool going into a hospital. That's where people were getting sicker, and the numbers were staggering out of Italy. And we can learn from the people before us what happened, so we know kind of potentially what's going to happen here. Crystal, stay at home mama here. Been wanting to sew masks to help, but I haven't because I hear so many different views on them. Yep. I want to help too. That's a big microphone. Thanks. Enjoy it, bro. Really helps with the audio quality. Thanks. Great place for my strong mama. Arrive trial. Oh, Frisky Flores. Arrive trial was a trial done recently in, I don't even know the year. What year is it right now? I think it was 2018 or 19. That was, it kind of changed the way people thought about induction leading to cesarean. And it showed potentially in a group of young parents in a few hospitals that had very strict regulations to be in this study, and it wasn't double blind, obviously, that potentially there could be no higher risk for a cesarean with an induction of labor. So pretty much from that day forward, it changed how many hospitals viewed induction of labor. And at 39 weeks, many people think that it's just like no, no more higher risk for a cesarean than without an induction at 39 weeks. So they say at 39 weeks, anyone can be induced, and it really doesn't affect your risk for cesarean. But rarely are all facilities handling inductions as those facilities in the ARRIVE trial. So there's some wiggle room in that, but that one study changed things very quickly and very dramatically. Hey, Leah, I'm a stay-at-home mom. I used to be a CNA. I feel the call to go back to work, but I can't bring myself to do it because of my 10-month-old and his great-grandpa. Hey, thanks for sharing that. You're sitting in a tough place, Leah. I appreciate you sharing that story and sharing the honesty. I've had similar conversations with my husband about working and supporting people hands-on, and also how I would sleep at night knowing that I'm making that decision and then potentially bringing home bugs to my family. Yeah, I can relate to that. Totally, totally, totally. Thank you for sharing with me. Thank you guys for being here in this chat, for being here live. So I'm not just talking to myself, which is what it looks like in my office. But I really appreciate you. If you can see, we're all set up for the live childbirth ed class that we had last night. And Julie and I are talking about our next one. So you can find some links down below. I have to change it today, but the link down below or the link on my site will lead you to a wait list if you want to be part of our next live. We had a lot of fun, and some people from there are here today. So that's pretty cool. So I am excited to continue the conversation, even though this is pretty shitty. It is pretty shitty, and I don't like it, and I feel weird. I know it's not. Hey, Ella from Bangkok. I know it's not. I know it's going to hurt people. I know I already am getting negative feedback about this, and like I should be quiet because hospitals are doing the best they can, and I should promote the best that they're doing, and I shouldn't steer people away from being in a hospital. I think hospitals are doing a pretty good job of that on their own. I'm not telling you what to choose, and I never try to do that. So if you ever feel like I'm telling you there's a right answer, tell me, or I'm not. That's not my intention at all. I don't know the right answer for you, and I'm talking to people that are not all healthy pregnant people, right? And nurses that don't have options. So I don't know the right answer for you, but I can't just say, go do this at a hospital. And I just can't sleep at night knowing that this is going on, and kind of knowing that we knew this could happen and we knew this was coming. That's what's sitting heavy with me right now. So if there is discussion about, how safe it is to be at a hospital right now, the measures that they're taking to keep pregnant people completely separate, I would love to hear about that. But I also would love to hear about the other options that people have to stay safe while they're having a healthy birth experience. Because I think there are options in birth. That's why I do this. So I love the conversation. Thank you. Keep it coming. Keep it coming in the comments, or you can find me on Instagram, Mandy Birth Nurse. I will see you next time. I don't know if it'll be tomorrow. Going live every day is a little taking its toll on me, but I want to continue this and talk about options for nurses that are really feeling torn in their role right now, or providers, whomever is in the healthcare field, feeling torn by their role and want to continue this conversation. Let me know what you want to know, and I am getting some research together for you. All right, this is the next video. I will see you there, and in the meantime, feel your feet on the ground. Bye.